PhD program some number of years ago. And with me in the Spatial Sciences conference room is Jennifer Ailshire, Laura Ferguson, and Robert Voss, who is the Director of Graduate Programs within the Spatial Sciences Institute. And today we want to share with you something about the character and the cadence of the Population Health and Place PhD program. So next slide, Karen. So as I said, there are three presenters. This is a degree that's offered using courses from three departments that I'll talk about. And then I'll talk about how faculty can affiliate with this program, which is in many respects more important than the departments I'm going to talk about. And then my two colleagues here, Jennifer and Laura, are going to talk about research opportunities and what they see as the value of the program and the kinds of people that it would serve well. But I'll do that probably after I talk a little bit about the curriculum and some of the students. So next. So that's us. We all have multiple appointments. We all have some kind of appointment and affiliation with spatial sciences. We have complementary interests. They're on it. Okay, thank you. And we're all actively engaged in working in and with the program today. Next. So spatial sciences, notwithstanding it's an institute, it has a whole bunch of academic programs, 16, 17 or 18, depending on how you count them. The institute was established on July 1st, 2010. Today it has 12 interdisciplinary faculty, 42 faculty affiliates and 8 staff. It has a central University Park campus location. We're in the Alan Hancock Foundation building. There are a set of faculty and staff offices, as well as being renovated state-of-the-art teaching spaces. There's a substantial research enterprise, and more importantly, there's a large computing infrastructure that supports both the academic programs and the research enterprise, and all of that is operated from our own place. And within the university, the Spatial Sciences Institute is the administrative home of the Population Health and Place PhD program. So next, Aaron. And roughly 1/3 of the courses come from us. The other, some other courses come from the newly named Department of Population and Public Health Sciences. It was founded in 1978 as the Department of Family and Preventive Medicine. The family part was dropped sometime after that, and the new name was adopted, I think, on July 1st, 2021. There's 100+ faculty and divided among 6 divisions: bioinformatics, biostatistics, disease prevention, policy and global health, environmental health, epidemiology and genetics, and health behavior research. It's a large research and teaching enterprise. It's super successful at NIH grant funding, and it's located in the Soto Street building, which is next to the Health Sciences campus, which is about 7 or 8 miles from here. So people in this program are going to participate actively working with faculty and taking classes probably on 2 campuses. Next. And then the third partner here is the Department of Sociology. It's a long-standing department. It was founded in 1915, so it's been around for more than 100 years. It has a vibrant intellectual community, 3 undergraduate majors. It's got its own sociology PhD program, and many of its faculty play a role then in the Population Health and Place PhD program as well. It has a number of affiliated research centres. Much of the strength and the research enterprise is collaborative with those research centres, and it too has a central University Park campus location in the Hazel and Stanley Hall building, which is maybe a 5-minute walk from here. Next. Now, I'm not going to read all these names, but basically the way the program is organised is that those 3 units I talked about are only important in the sense that they provide the core requirements for the coursework for the PhD. the most interesting part of the PhD is the faculty that you can work and associate and interact with. And so basically what we have is we have a list of faculty that are designated population sciences. We have a list of faculty designated health sciences, and we have a list of faculty, if you like, that are labeled place or spatial or something like that, right? And on this list here, we just have an alphabetical list of faculty. So next slide, Aaron. So, and then next slide, and then next slide, and then next slide, and then next slide. So the key point here is there are 38 faculty who have been pre-approved to operate in one of those three domains, and they are all available to serve on a committee, to be approached as co-advisors. We see them as active parts of the PhD program, and they are at your service if you were lucky enough to be offered a spot in this PhD program. There are some rules. They have to play nicely, as everybody affiliated with spatial sciences does. And I think the other rule is that you can only be on one list. So me as an individual, I actually have faculty appointments in sociology, in spatial sciences, and population and public health sciences. So technically, you know, you could make the argument maybe I could be on 2 or 3 of those lists, but I'm only on the spatial list. And this will become important when I talk in a minute about how the program's organized. So next. So there's lots of research opportunities. Jennifer and Laura here, and I'm going to ask them to talk about that in a second, but to prepare that, Jennifer Ailshire's primary appointment is in the USC Leonard Davis School of Gerontology. One of Laura's appointments is in the USC Institute on Inequalities in Global Health. I have a leadership role in the Southern California Environmental Health Sciences Center, as well as the Southern California Clinical and Translational Science Institute. And tomorrow, or Friday, we anticipate that we'll be announced as one of the new centers for chronic health disparities in Latino children and families, where I have a leadership role as well. So USC is a place with a lot of strength on interdisciplinarity and a lot of strength around human health, but maybe more likely human well-being writ large. And so with that, I'll stop for a few minutes and I'll let Jennifer and Laura speak, and then afterwards I'll tell you something about the nuts and bolts of the PhD program were you to join it. So Jennifer, do you want to go first?
Yeah, so I think I've been affiliated with the Spatial Sciences Institute since I started my faculty position at USC, and I've had a lot of interaction with the PhD program and some postdoctoral scholars that were here and other events. And although my primary appointment, as John said, is in the School of Gerontology, I think of spatial sciences and the PhD program in particular as one of my main intellectual homes on campus. That's where all of my friends who are as spatially oriented and maps obsessed as I am all hang out. So work with 3 PhD students at the moment. And for me, the PhD students are ideal for the kinds of research projects that I do. I work with a lot of administrative data sources to produce data sets on environmental factors like air pollution and social characteristics from census data, for instance. And then I link that to survey data, and we do analyses for publication. But to have students who understand the importance of connecting data on people and places is really unique. And so that's why I work really well with the PhD students. And I don't think that there's been a single student who hasn't had a truly fascinating topic in the program. It's a very unique combination with this focus on population health and place that you can't really get just anywhere on campus, although there are those of us who are kind of sprinkled throughout the land. And so I've also served on and served as co-chairs of dissertation committees as well. So I think what we have here is an intellectual space. It's not, there is a physical space, but it's kind of interesting that this spatially focused, place-focused program, it is not actually constrained by physical space in the way many programs are. And so it's quite diffuse across campus, and it really serves as a hub to bring together a lot of the faculty and the students who are working on similar topics with interests in the environment and population in place. It kind of brings us together under one banner, so to speak.
Okay, thank you. And then Laura.
Sure. I mean, just to add to that, I mean, first of all, totally agree with all of it. I think one of the most exciting things to me about this program is the range of faculty and courses to which students have access, and the fact that you have to adopt this kind of multidisciplinary approach to solving complex problems. And I think, you know, USC has so many strengths across so many different schools, and there's just this wealth of support that's out there, everybody coming from their own different perspective. And I think being able to pull from these three different areas of population health and place and figure out how to bring different perspectives to that and how to work across disciplines with different faculty is an amazing experience that students can have. I think that the students with whom I work are incredibly intellectually curious. They're very open-minded about research and almost don't want to be put in a box of, you know, what is your discipline, but really want to figure out how to push intellectual boundaries, to push conceptual boundaries in ways that I think are dynamic and really needed in most fields. So I co-chair a couple of PhD dissertation committees and advise other PhD students as well. And I obviously, you know, coming from the Institute on Inequalities and Global Health, it's clear where my focus lies and really what I can bring. Like, all of my work is overseas, much of it in sub-Saharan Africa, but also some in South America and Southeast Asia. And so that kind of brings a whole different dimension of place. But really what I focus on is the idea of inequalities, and I bring a policy lens, I bring a human rights lens, and I bring kind of qualitative methods, which is something that's quite different to what many people here focus on. But if people want to bring some of those issues in as one of their dissertation papers, to start thinking about how do we combine these different types of data, like, so how can you leverage qualitative data to help understand spatial science, spatial data sets, right? How do we need to think about inequalities and the kind of modeling that we're doing in order to inform policy? So those are the kinds of questions that I'm really working on with people. And obviously the network of collaborators around the world is a useful thing. And bringing students into the research that I'm doing, be it with United Nations agencies or partners in Africa or elsewhere, is something that I think can be really exciting as well, in terms of being involved in very much real world research as we go. So I think we're a tiny slice of what's here, but there really is, it's an amazing faculty when you look across that list, and people who I think, you know, it's a privilege to be part of it and to be brought into these different committees with different faculty from across the university, working with students who really are open to intellectual exploration.
Thank you. So maybe I could say something about the list that I flashed up and then passed straight in front of you. Jennifer Ailshire beside me here is one of a number of faculty on the list that come from the School of Gerontology. Laura is part of the Department of Population and Public Health Sciences. Such a new name, I have to think consciously how to say it each time. But I bet we have people from all 6 divisions within what is a very large department in this university. But there are also quite a few faculty from the Department of Sociology, as well as a group of faculty here within Spatial Sciences. But then also faculty now in the Department of Planning and Spatial Analysis in the Price School of Public Policy, faculty that are affiliated with the School of Pharmacy and Price, and maybe collect together naturally in the Schaefer Centre for Health, Economics and Management, I think, or something like that. Policy. And then there's another whole group of faculty that are suddenly engaged in participating in the program from the School of Social Work. And so the idea here is that what we do is we stand up a big tent, we specify a couple of ground rules, and then anybody that wants to be in the tent basically will be welcome. And so we really are, that's our DNA, that's what we're trying to accomplish, and to build bridges. And so can I have the next slide, please, Darren? And so we've just got a few levers that we use to do that. And so this is the required curriculum for the PhD. So there's a really audacious class that starts it, that so far I teach, called the Geography of Life and Death. Really big title, but the goal is to get the students to be thinking broadly and creatively about both the topics they could do and in helping them sort out the domain or the specialty that they want to focus on for their PhD. The first 2 summers, there's a population health and place research practicum. There's a way that we make that financially possible that I'll speak to in a moment. And then you'll see there's 3 classes from what was preventive medicine. I'm not sure they've changed their prefix yet for their courses. In the middle, there's 2 classes for sociology, and on the right side, there are 3 classes from spatial sciences. It used to be 3, 3, and 3, but for various reasons, we were encouraged to make up our own advanced quantitative methods class. So there you see that up there as SSCI 681. And so quantitative methods was pulled out of sociology and lifted to that top layer. Now, students are going to come with multiple backgrounds. So if you came with a degree in spatial sciences, then typically what we would likely be doing is substituting for classes on that right-hand side. If you came with a degree in demography, we might be thinking of substituting, but in the same domain for those courses in the middle, and the same on the left as you look at the slide. If you came with a master's in public health, we would probably substitute a higher level biostatistics class, a different epidemiology class, and maybe a different environmental health class for the one shown there. So we're trying to create breadth and at the same time help individuals on a case-by-case basis build depth, right? And so that's a very important criteria. So next, maybe Darren's not back in his office yet. You know, that's the minimum set. There are plenty of electives around the university. This is not a complete list. This is just a sample. But there is a class on spatial statistics that some students find helpful. Laura spoke to the importance and some of the issues in global health, and so on and so forth. So there's lots of opportunities. It's knowing where you're heading and where you want to head and aligning opportunities with your mission that's important to you. So next, please. So let me talk about some of the nuts and bolts that you maybe have already thought about asking us questions about. So people always ask us in this session, or they write separately and ask, well, what's the preferred background? There's not one. There's a number that are probably going to set you up quickly for success in a program like this. So if you had a background in geography, or if you had a background in public health, or if you had a background in virtually any of the social sciences, or perhaps some of the computational sciences, but you have this burning desire to work at the intersection of population, health, and place, then you're a good candidate, right? And so it's as much about who you want to be as it is about who you've been up till now. The admissions criteria is that we want to be in the business of helping to train and groom and graduate leaders. Leaders could work in the private sector, leaders could work in the public sector, the not-for-profit sector, or in the academy. I can say that, well, thinking about my own life, if you want to lead quickly, you're going to pick something other than the academy. It's taken me 40 years in the academy to become a leader. So the academy, it takes a while, you know, you get a tenure track job, you've got to get tenured, then you've got to get promoted, and all those things seemingly take half your life, right? But, you know, a person could get a leadership role within a county Department of Public Health, or within the federal government, or even within a company that has interest in health like Oracle, or one of the insurance companies, and you could have an impact that changed lives and changed outcomes for people more or less instantaneously, right? So when we look at the applications, we're looking to see who aspires to be leaders and how they can articulate in their mind what they have to do to be able to do that. You will not be assigned, nor will you have the opportunity to pick your 2 co-advisors upon entry. So every year, I have the privilege of inviting 6 of my faculty to be on an admissions committee. I sit there just to, well, 1, I have to pay the bills, but 2, to break ties. And so the goal is to pick 2 people from the population sciences list, 2 people from the health sciences list, and 2 people from the place list. And I then ask them to rank the rank the candidates in terms of their leadership potential and goals, and to some extent their academic training to date, and whether that's aligned well with their goals or what they could do by taking our program. And you know, I think last year we had 38 or close to 40 applications, and these 6 people gave me a unanimous set of recommendations. If you're going to make 1 offer, this is the offer to make. If you're going to make 2 offers, these are the 2 offers to make. And I think that their recommendations were unanimous all the way down to number 9. And one person had 9 and 10 in reverse order, and everybody else was good, same order down to the top 10 recommendations, right? We would want you in the program to be able to identify your 2 co-advisors by maybe the end of the fall semester of your 2nd year. That would be the best case. An okay case probably would be to know that at the end of spring semester of your 2nd year. One advisor has to come from one of those domains, and the other advisor needs to come from one of the other 2 domains. When you form a dissertation guidance committee, there needs to be at least 1 person from each of the 3 domains. And so if you picked an advisor in health and you picked an advisor in population, then one of your guidance committee members needs to come from the spatial list, right? We administer the program. It's not a requirement that all students have an advisor from the spatial list. This is a 3-legged stool, and the stool legs are equal in terms of importance and everything else. So the funding. So at USC, you know, it's a very entrepreneurial place. From where we sit, I need to make 5-year offers of funding. Those 5 years need to include a minimum of 2 fellowship years, and then full support for the other 3 years. Currently within the university, the minimum offer I'm allowed to make is $30,500 for 9 months. Given the role of the research practicum, we will make successful candidates an offer that includes top-up funding of an additional $10,167, I think, in each of the first 2 summers. So we would be making an offer that's $30,500 plus $10,165 for the first year and the 2nd year, and then it retreats to $30,000 for years 3, 4, and 5. The first year is typically students are on fellowship, and in most cases, but not all cases, they take their 2nd fellowship year in the 5th year. of the program. It's a 5-year program, at least it's imagined as a 5-year program. Opportunities for those non-fellowship years are typically either finding external competitive fellowships or finding internal competitive fellowships, because they exist as well, or being a graduate teaching assistant or being a graduate research assistant. In general, in spatial sciences, we need about anywhere from 7 to 9 graduate teaching assistants in fall and spring semester. And I'm currently forecasting that I'll have 2 students available to TA in spring 2022. This semester I needed 8, but I only found 7. So I had to be super creative in finding some additional resources. Often that's seen as the support of last resort, because there's all these exciting research experiences that you could get from working with faculty all across campus. I think it's fair to say that Los Angeles is not an inexpensive place to live. And so most students seem very motivated to find additional support in those summers in the 3rd, 4th and 5th year so they can make ends meet. I talked about selection and major advisor. The career trajectories, we're really focused on outcomes that are built around people growing and assuming leadership roles at the intersection of these 3 fields. We are indifferent as to whether they happen in any of the places that I spoke about. And so we're not just in the business of training additional academics, we see that role broadly. So next, Darren, just 2 to go, I think. See there. So what I can say while I'm waiting is that we have a here we go. Now you've jumped 2, Darren. So can you go back 1? Maybe not. So the slide I skipped was just pictures and a byline for 6 of our current PhD students. I think right now, Bob, do you remember the number we have in place now? It's about 20 or 21. Right around 20. It's right around 20 or 21. We're not trying to grow the biggest PhD program in the world. We're trying to grow one of the best PhD programs in the world, right? So quality trumps quantity here. And so these 2 this one young man and one young woman here, these are from our first cohort. And so if they were students now, they would be starting their 6th year. But in these cases, they're not. They both successfully defended and uploaded their dissertations to the graduate school in this past summer. And so Douglas, his dissertation topic was spatial temporal analysis of out-of-hospital cardiac arrests and bystander CPR in Los Angeles. The key thing here is that his 2 co-advisors, one was from sociology and one was from emergency medicine. They were faculty, one on the population list and one on the health list. And he now has a job as GIS project coordinator in the Center for Disease Control, Geospatial Research Analysis and Services program. And I think he's based in Atlanta, Georgia. Joanna Abelard defended her dissertation a few weeks before Douglas. Her topic covered the LA homeless community water, sanitation and hygiene insecurity kind of crisis. And she was fortunate enough to win a postdoctoral fellow position at the University of California, San Diego School of Medicine, right? And so we were super excited because here's two of our students from the 3 who were the first cohort that have now graduated more or less on time and have already found positions that set them on the next step on their path to leadership. So with that, I think we could I could stop talking and we could take your questions. And if you could just specify who your question is directed at, then that would help us provide appropriate answers. There's 4 of us here: Bob, Laura, Jennifer, and myself. The slides can go away, I think they're on. Thank you. Anybody in the audience have a question?
Yeah, I had two questions. I was wondering, has there been past candidates that were funded by NSF through the GRFP or through Ford Foundation before?
Sorry, I didn't catch the by NSF, and who was the second one? Or Foundation. I don't believe that any of our students have ever applied to the Ford Foundation. I have some experience of that from my affiliation with the Department of Sociology, where it's been quite common, and some students have won awards. And have we had a student apply for an NSF graduate assistantship yet?
Yeah, we've had one application to the Ford and one application to NSF. Unfortunately, those were not successful applications, but we have a big infrastructure here at USC to encourage students to take on fellowships, external fellowships. And so I think that John mentioned, for example, you would likely, if you win one of these, you would use that to take a year where you had a teaching or research work obligation, and you would convert that into a fellowship year, which would give you an additional year of support to focus on your particular research objective. And so, so it doesn't take away from the package that we offer is the package we offer. And then if you can recruit external fellowship funding or external RA funding in the summers or whatever you can recruit, you can add on to your support for your research and for your program. So Jamie, does that help situate that?
Yeah, that answers my question. Thank you. The other question was going to be, I mean, this is sort of more basic, but I wasn't sure from the application. Is there a preferred page limit for the writing sample or no?
I think you really can give, you can give more than one writing sample. And we're happy to look at whatever you think your best work is. And if it's long, we will, we'll read it. We'll read it as best we can. We read a lot of applications. We devote a lot of time to reading applications so that we can really find the very best candidate. And so, I think one of the things that our candidates need to do in the application process as well is exhibit their, exhibit to the degree they already have some cross training in the three fields, probably show that, right? And so it could very well be that more than one writing sample would help you do that, or a poster and a writing sample, or these kinds of things. And so I'd rather you not think that you're somehow limited. I want you to put your best foot forward in your application as best you can, and let us deal with the volume of it. Does that help?
Yes, thank you.
Perhaps somebody else has some questions?
You could throw them in the chat. We can see the chat coming up over. Actually,
all right.
Go right ahead.
Can you hear me?
Yes.
All right. I had put my hand up, but I think it wasn't seen. All right. So I have a question regarding the GRE. I know I submitted an email asking about this, and Robert Voss had to answer me, but I just wanted some clarity again on it regarding the GRE scores, submission of them, and then secondly about the English proficiency, because currently I'm finishing up with my master's here in South Africa, Cape Town University. I did my undergrad from Uganda. So it's a little bit confusing to me. So I just needed some clarity regarding that, because given the lockdown thing, it's a difficult process to organize these two things. So I just want to get clarity on those two, GRE and English proficiency. Thank you.
So the GRE is required, and the English proficiency is required. I think it depends on the country that someone's coming from. And so I know your case was somewhat complicated, Jacob, and I emailed you back about it. Jacob, if you're having trouble sitting for the exam, let's talk about that, and I will, for the GRE, for example, or for English proficiency, let's talk about that, and I'll see what help I can get here from USC in terms of ensuring that you have an opportunity to sit for the exam. So, so that would go for anyone in the meeting as well. We'll work at that to make sure that everyone has an opportunity. So, but that is what that is right now what the admissions requirements are in our program.
All right, thank you very much.
Yeah. I would say that I do want to point out, many people we know, maybe mid-career and maybe coming back, and please don't let the GRE or the English proficiency exam, be an obstacle that prevents you from applying. It is a requirement that the university has, but I think from the perspective of the admissions committee, we're very interested in your background, your educational background, your professional background. We're very interested in your personal statement. We're very interested in your writing samples. So please don't have the fear of those tests be a hindrance in your application. I think that's really important to say to everybody.
I have a question about that writing sample. I know you had mentioned there was no page limit. If we were to submit, say, our master's thesis, would you want like an excerpt of it or the entire?
No, I'd be very happy to have a PDF of your master's thesis. Absolutely. Yeah.
Awesome. Thank you.
Yeah.
It's not possible for us to see.
If they don't put their camera on, we can't see them.
Oh, I see.
So the folks we see now are the folks who has cameras around.
Correct. Olga, did you have a question?
Yeah, I did actually. I wanted to ask about the genuine support for qualitative practices, research practices. I'm interested in mixed methodologies, but I did notice in the requirements, there was a very strong emphasis on gaining quantitative skills, and the one qualitative class was an elective. So it kind of revealed a little bit of a bias, and and I know public health leans towards quantitative. So I just wanted to hear what you all had to say about that.
So the way I explain this typically is to say that it would be, I don't think we would expect a dissertation in our program that would be all qualitative. We have several dissertations underway right now that are mixed methods and are very heavily mixed methods. And so the students there have taken, they've found various places, as you've noted, to take an elective, right? And so there's a qualitative methods class in sociology, there's qualitative methods classes at Keck, there's a narrative medicine program at Keck.
Well, I think just to add to that, there are qualitative methods classes all across the university, but I think what's also important is the experience with faculty. Like, I know I have worked with students to bring them onto my research if it's related to what they're doing or skills they want to develop, to help them, whether it's learn or practice qualitative methods, be it data collection or data analysis, or like how to bring that together with the quantitative data that they might have. And we can do that as a directed study module, or we can do it outside. It can be an RA-ship. So there's, and it's really not just me, there's plenty of other people on the faculty, on the Institute's faculty who do that as well, who will bring the PhD students into ongoing work to provide exactly the support that you're talking about.
Great, thank you. That was helpful.
Olga, the other answer might be that to be successful in the world now and in the future, one probably has to be somewhat, certainly knowledgeable and agile about working around both quantitative and qualitative methods. And that it's not one or the other, but really how one would marshal and use them together when and where appropriate.
So Olga, you may not see it in the course titles, but our first summer practicum course does deal in qualitative methods as well. So it's a spatial sciences class in qualitative methods. And I think the students are often surprised in that class. I've had the privilege to teach that class for several summers now. And the students are often surprised at how many qualitative methods there are in the spatial sciences, actually, right? And what we discover there. So we figured we look at how to blend that, blend methods in an interdisciplinary way. So.
Any other questions?
Do you want to ask Kate to see anything?
It'd be really, actually would be very nice. Kate, if you are, so one of our current PhD students has really been very generous and joined us today, Kate Bavram Musar, and she would like to share any thoughts or anything like that. Would sort of give her an opportunity to, we have a few minutes here. Questions, but thank you for joining us, Kate. And you just, you guys, so you know that Kate is here. And we'll leave the room open for a few minutes. If anyone has a question for her, I'm sure, I think she'd be happy to take it, or you could chat her a question or ask it in the open forum here. It's really.
Yeah, sorry. I think my computer locked up for a moment, but yes, I'm more than happy to. I also am happy to answer anything over email. So I'm going to put my email in the chat if anyone wants to follow up and ask me questions as a PhD student who's been through a few years of this program.
Thank you, Kate, very much. Very generous.
Okay, so if there's no more questions now, thank you for that offer, Kate. And if people want to, I encourage them to follow up with Kate. She's very knowledgeable. But if there's no more questions, we'd just like to thank you for attending this session. And that if you're still interested in applying, we all look forward to seeing your applications and wish you the best no matter where life takes you next. Thank you.
Thank you all very much.